I'm Dr. Michael Faber. I'm a licensed chiropractic physician, and I've been practicing as a chiropractor for over 30 years. One of the biggest statements I hear from patients when I talk to them is that they seem to get the brush off from a lot of other healthcare professionals. They don't want to listen to them. They don't take the time. Many patients have been told to go see a psychiatrist, to go see a pain management doctor. In this day and age with specialized healthcare, those physicians have a very narrow mind of what they can do for the patient.
A lot of time with pain in allopathic care, at least in my experience, it seems that you can be gaslit or people just don't believe what you're going through. So yeah, I'm getting a little choked up because it means a lot, like, to have a doctor actually believe.
Most people know exactly what they're feeling. They're very clear on what they're experiencing, and that really helps me to understand how they feel and what I really need to do for the patient. The patient really helps me decide what the best treatment for them is.
I love Dr. Faber. When I first met him, he had such a bedside manner that was not common for professional people. But that's one of the reasons I kept coming back, because I connected with him. Because I like people that, people that are genuine, not trying to just tell you one thing. He said he would work with me until, I would see results or whatever. So I stuck through it.
Dr. Mike he's gonna tell you what you need, and I don't think he's gonna sugarcoat it or anything. And let's give it if he thinks something will help, he's going to tell you. If he thinks, well, maybe we'll just have to give it a try, he's going to tell you.
When a patient comes in to me for a consultation and they're trying to get rid of their pain, that's the reason why they're coming in, I try to understand what their journey has been. I just don't want to know, what do you feel like today? I want to find out, when did the pain start? How long have you had the pain? What have you done for the pain? And what do you want to acquire going forward?
Pain that I used to have begun actually back in college. I had a shoulder pain that bothered me and continued bothering me and just got progressively worse as I aged. And then I had a knee surgery, and about 6-8 months after the knee surgery, that was giving me some bad pain also, and it was enough where it was waking me up at night sometimes, and both of those pains were very bothersome.
Well, I have something called CRPS, chronic regional pain syndrome. Some people call it RSD. Started in my arm when I was 39, and I'm 66 now. Unfortunately, it's a pain syndrome that if you have an injury somewhere else, it can spread to that area wherever you're injured, and it's in my right foot.
I mean, I've had neuropathy coming down the front of my left quad, and it's just been bad. It's been bad. I literally couldn't eat. I mean, pain was so bad that I was actually vomiting.
The most important thing in understanding a patient's pain is listening to their journey from when it started. What are they experiencing? What have they done for it? And why are they seeking continued treatment? In order to assess a patient properly, many times I will take x-rays. I have digital x-ray capabilities here at the clinic, and I can take x-rays here. So I want to see what's going on biomechanically with the structure of the joint and the spine especially. From there, I will do a number of neurologic and orthopedic tests as needed in order to determine what is causing the pain, where the pain is coming from, and what the extent of the pain is. Calmare, which is also called Scrambler Therapy, is a transdermal neurostimulator. So it stimulates nerve activity through the skin. It's administered by applying electrodes on the skin that send signals through the nerves, the C fibers, the pain fibers, back to the brain. So it's actually sending normal signals through those fibers back to the brain so that the brain experiences a flood of normal signals from the area that we are treating. That way, when an abnormal signal comes from the area that the patient experienced pain, the brain will ignore it. Retrain the brain to ignore the pain.
I do write a lot of poetry. I write a lot about my condition specifically. I have complex regional pain syndrome type 1. It started off as just a basic sprain, and my pain just slowly kept progressing and progressing as time went on, and there was a lot of unnecessary medical treatments and stuff, like, oh, you're making it up in your head, your pain's not real, it's not there, type deal. And then as time went on, I started seeing more specialists, and then that's when they had brought in the idea of CRPS type 1.
If the patient is having neuropathy or neuropathic pain, that's a little bit different condition where a lot of times the nerve is the issue and it's not something else that is causing the nerve to degenerate, causing the nerve to be impinged. If neuropathic pain is there's something wrong specifically with that nerve in and of itself. Calmare therapy helps to relieve that pain. It doesn't fix the problem that's causing it, because in a lot of conditions there's no way to fix that problem. When you have diabetic neuropathy or you have post-shingles neuropathy, the damage is done, and a lot of times you cannot reverse that. And so Calmare helps to change the signaling of the nerves back to the brain. So basically retraining the brain to ignore that pain signal.
The Calmare treatment basically feels like it just calms your whole nervous system. From what I've learned, Calmare attaches onto the C fibers in your nerves, which is responsible for pain response and temperature changes. So it basically attaches onto those C fibers to combat the pain signals being sent to the brain. So it basically just feels like it calms the whole nervous system, and the electrodes give a slight pins and needles sensation, but it's very tolerable, very, very comfortable, and just makes you feel very relaxed and calm.
As a certified Calmare provider, you have to show a certain level of proficiency in being able to deliver an effective treatment to the patients. There is a level of skill and ability and knowledge that's necessary in order to deliver an effective treatment. And also, we do a trial treatment of 3 treatments, and that's really an important aspect of the process of Calmare. We want to do 3 treatments just to make sure, number one, that the patient is going to get results, but also number 2, that they're going to be committed to follow through with the full protocol, which very often is about 10, 11, or 12 treatments, depending on how well they respond.
I've been able to clock more hours at work, gain at least that part of my life back. Been able to go out a little bit more, have more socialization with my friends and stuff, because I feel like before I started Calmare treatment, I was really antisocial. I didn't really want to be seen by anybody. I was more reserved, just kind of like, don't bother me type deal, just because of how much pain I would be in on a day-to-day basis.
MLS Laser Therapy stands for multi-wave lock system. So the reason why it's called multi-wave is because the MLS laser has 2 wavelengths of light. One for pain relief, it's an analgesic effect, and the other one is an anti-endemic, anti-inflammatory effect as well. And also it stimulates the mitochondria activity in the cell. So not only do you get rid of the inflammation, but you also stimulate the cell to do what it normally does, and that's heal itself.
Some of the symptoms I was having with CRPS was burning, numbness, what else? I had some atrophy in my muscles as well, and just, general pain.
Pain that I used to have begun actually back in college. I had a shoulder pain that bothered me and continued bothering me and just got progressively worse as I aged, and then I had a knee surgery, and about 6-8 months after the knee surgery, that was giving me some bad pain also, and it was enough where it was waking me up at night sometimes, and both of those pains were very bothersome.
Patients' experience with MLS laser is very relaxing. They get to wear these cool sunglasses to protect their eyes, and they're either sitting or lying down on one of our therapy tables, and the light energy is applied to the area that we're treating, and the patient 99% of the time feels absolutely nothing. So there's no pain involved at all whatsoever. The predictability of the laser is fairly high. If I feel that we can get results based on the evaluation, based on the patient history, the probability of getting good results is anywhere from 85 to 95%. That's pretty much our success rate with giving patients a satisfactory result where their pain level is less or even completely resolved.
The treatment here hasn't only helped my pain, but it's also improved my quality of life. It's bring back my confidence, and yeah, it's just improved my whole life. So, yeah.
The MLS laser, I don't know how magically it did it, but it did it. It took the pain away, gave me back my mobility, and the biggest part was that the pain was gone. That was the most important part.
I'm Dr. Michael Faber, and I want to know your pain journey.